Hi everyone, Jackson here and welcome back to the channel. Today we're going to be tackling a really interesting topic that's sometimes referred to as the silent killer: high blood pressure or hypertension. Now we all know that heart health is crucial, and usually when people talk about this, cholesterol gets brought up and it gets a lot of airtime. Now while it is important, it is not the only factor that's out there. And there are many significant things which can contribute to high blood pressure, factors that you might not even be aware of. And that's exactly what we're going to be diving into today. We're going to be uncovering 10 surprising and some not so surprising reasons why your blood pressure might be creeping up. First, a super quick refresher of what is blood pressure. Think of it like this: your heart is a pump and it's pumping blood through your arteries. Blood pressure is the force that blood is getting pushed through with your heartbeat, and that pressure goes against the walls of your arteries. When the force is consistently high, this can actually put damage onto your arteries and puts a huge strain on your heart. So blood pressure is usually measured with two numbers: systolic, when your heart beats, and diastolic, when your heart rests. Generally, anything that is over 130/80 is considered high blood pressure, but always check with your GP. That way you'll know what your specific numbers are, and if you have your blood pressure checked on a regular basis, you'll know where your base levels are. Alright, so let's jump in with these 10 crucial factors. Stick around because some of them may surprise you. Reason number 1, high salt intake. First up, a big one: too much added and hidden salt in your diet. Now, sodium makes your body hold on to water, and the more water in your blood means the more volume, and the more volume means the more pressure against your artery walls. It's like trying to push too much water through a garden hose. So be mindful of hidden salt in processed food, especially ultra-processed food. Even restaurant meals can have a higher level of salt than you would usually do in your home cooking. Read the food labels, aim for less processed food, and cook more often at home. Cook from fresh. It's always much better for you. Reason number 2, lack of physical activity. Next, you've probably heard this before, but it's vital. Not enough physical activity. Your heart has to work harder to pump the blood around your body. Plus, inactivity can lead to increase in weight, which puts an even more strain on your heart and the whole cardiovascular system. Even moderate activity, like a brisk 30-minute walk, can make a huge difference to you. Start small. Take the stairs instead of the elevator. Have a walk during lunch. Find an activity that you actually enjoy. Reason number 3, being overweight or obese. So closely related to an activity is being overweight or obese. Extra body fat, especially around your midsection, increases the demand on your circulatory system. Your heart has to work much harder to supply your blood. All that extra tissue, all that extra weight leads to more exertion and leads to higher pressure. Even a modest weight loss can significantly lower your blood pressure. Focus on a sustainable lifestyle, rather than linking in with fad diets where your weight is crashing up and down. Having a consistent approach to your food and your lifestyle is going to be much healthier for you in the long run. Reason number 4, excessive alcohol consumption. The next impact, drinking too much alcohol. Well, a moderate amount might not be harmful for everyone. Regular excessive alcoholic intake can significantly raise your blood pressure. and it can also interfere with blood pressure medication that you may be on. So moderation is the key here. If you drink, stick to the recommended limits. If you struggle with alcohol, please seek help. Try alternating alcoholic drinks with water. Or even better, have designated alcohol-free days. Reason number 5, old age. This is something that none of us can avoid, age. As we get older, our blood vessels naturally become stiffer and less elastic. This makes it more difficult for the blood to pass through. This increases the pressure that's needed and required to actually push the blood all the way around the body. So, while you can't stop aging, understanding that as you get older, you need more regular checkups, and it becomes critical. So start monitoring your blood pressure as you approach middle age, even if you feel fine and don't feel any of the effects. Reason number 6, genetics and family history. So next up, another factor that's largely out of your control, but it's important to know: your genetics and your family history. So if your parents or your close relatives have high blood pressure issues, you're at a significantly higher risk of developing it yourself. It's not always guaranteed, but it stacks up against you. This simply means you need to be more diligent with your lifestyle. Additional factors that you can control. Talk to your family about their health history. If hypertension runs in your family, be proactive with your diet. Exercise more. Have regular checkups. It's important to keep an eye on it, because even though you feel fine, you may not be fine. Reason number 7, chronic stress. So this one's known a little better. It's what's known as chronic stress. So when your body is stressed, it releases hormones that temporarily constrict your blood vessels. It speeds up your heart rate, leading to a spike in blood pressure. Now, if you're constantly stressed, the temporary spike can turn into a sustained high blood pressure situation, which is not good for you. So controlling stress is vitally important. Learning to manage stress is incredibly important, not just for your blood pressure, but for your overall well-being. Incorporate stress-reducing activities like meditation, yoga, deep breathing, or spending time out in nature into your routine where you can. Reason number 8, certain medical conditions. So this is a big category. Certain underlying medical conditions. This is where high blood pressure can be a symptom of something else, known as secondary hypertension. So let's break down a few key ones. Kidney disease. Your kidneys play a key role in regulating your blood pressure by managing fluid and salt levels in your system. If they're not working correctly, this can lead to hypertension. Diabetes. Both type 1 and type 2 diabetes can damage your arteries and kidneys, making high blood pressure a more common complication, and they usually go hand in hand. Thyroid problems. Both overactive and underactive thyroid can mess up with your whole heart rate, your metabolism, which has an obvious knock-on effect onto your blood pressure. Adrenal gland disorders. Your adrenal gland produces hormones that regulate blood pressure. Obviously, if they're regulating blood pressure, this can obviously have a massive impact onto hypertension. So this is why it's essential that you have regular checkups with your doctor. They can identify these underlying issues that may have a knock-on effect and be the reason why you're having high blood pressure. If you have any of these conditions, work closely with your doctor to manage them. Reason number 9, smoking and tobacco use. This one needs almost no introduction or explanation. Smoking or any use of tobacco products. Nicotine as a drug temporarily raises your blood pressure and your heart rate. More importantly, the chemicals in tobacco damage the lining of your arteries, making them narrower, harder, which can dramatically increase the risk of high blood pressure, heart attack or stroke. There is no good amount of smoking. There isn't. When it comes to your health, quitting is one of the best things you can do for your blood pressure and overall health. If you smoke, seek assistance if you want to quit. There are many resources available, and it is one of the best things you can do for prolonging your health. Reason number 10, certain medications. And finally, certain medications. It may surprise you, but some common prescription and over-the-counter medications can actually raise your blood pressure. These include certain birth control pills, some pain relief pills, like non-steroidal anti-inflammatories, think ibuprofen, decongestants, antidepressants, and even some herbal supplements. Always be sure to tell your doctor about all your medications, all your supplements, and even over-the-counter drugs that you may be taking. That way, they can be monitored correctly for any side effects or interactions that you have. Always review your medications with a doctor and pharmacist and discuss potential side effects, especially if you have an existing high blood pressure disorder. So there you have it, folks. 10 significant reasons why your blood pressure might be high, or showing how complex this silent killer can be. The key takeaway here is knowledge is power, even though some factors are out of your control. Many are within your reach to influence. Get your blood pressure checked regularly. Don't wait for symptoms, because more often than not, if you wait for symptoms, it can be too late. Small, consistent lifestyle changes, like reducing salt, moving a little more, managing stress, maintaining a healthy weight, giving up smoking, can make a massive difference in preventing blood pressure issues coming on. So, if you learned something new today, please do me a big favor. Give it a thumbs up, leave a comment, and hit that subscribe button. So, thanks very much for watching. Stay healthy, stay informed, and I'll see you on the next video. Bye for now.